Are we ready, everybody? Okay, start the meeting. It is 10 a.m., everybody. Welcome. It is to all those joining us via Zoom this morning or teleconference. This is the regular BCC meeting for April 21st, 2020 of the Board of County Commissioners. We are joined this morning with some of our commissioners here live in the audience, but we also have commissioners attending via Zoom as well. So with that, Madam Vice Chair, will you lead us in the Pledge of Allegiance this morning? Thank you, Madam Vice Chair. Appreciate that. All right, we are on to roll call. Madam Clerk.
Good morning, Mr. Chair. Bob Lucy, Chair.
Here.
Vice Chair Marcia Berg-Bigler.
Here.
Kitty Jung is present.
Present.
Phone. Von Hartung.
Present via phone also.
Thank you. Jeannie Herman.
Here.
County Manager Eric Brown. Assistant District Attorney Dave Watts-Fial. Oh, we have Nate Edwards, Deputy District Attorney, present via Zoom or phone? Present via Zoom. I'm Nancy Parent, County Clerk. You have a quorum, Mr. Chair.
Thank you, Madam Clerk. We appreciate it. All right, this next item is item 3, public comment. Mr. Manager.
Public comment. Comment heard under this item will be limited to 3 minutes per person and may pertain to matters both on and off the commission agenda. The commission will also hear public comment during individual action items with comment limited to 3 minutes per person. Comments to be made to the commission as a whole.
All right, thank you, Mr. Manager. Madam Clerk, I'm going to look to you first. Do you have any email correspondence, public comment that you received?
I do. I have 2.
Okay, I will let you read those into the record, please, this morning. 3
Certainly.
minutes each.
The first is from Diane Becker-Hirschberg, who indicates, "My name is Diane Becker-Hirschberg, and I'm a full-time resident of Incline Village in Washoe County. One of the lessons we've all learned from this COVID-19 pandemic is that Washoe County," oops, excuse me, I gotta set the timer. Sorry, Chair.
It's okay.
Is that Washoe County needs to be able to make temporary rules and regulations governing short-term rentals during times of emergency and disaster. As the Washoe County short-term rental ordinance will be coming back before the County Board of Commissioners in the near future, I have a request to make on behalf of the residents of Incline Village, Crystal Bay. This request is also applicable to and would benefit all of Washoe County, in my opinion. Our request is that a provision be included in the Washoe County short-term rental ordinance that Washoe County reserves the right to issue orders, directives, and advisories that must be adhered to by short-term rentals during these times of emergencies and disasters and for other health and safety related purposes, and that these orders, directives, and advisories must be followed by the owners, renters, property managers, and online rental services. The applicant for a short-term rental permit should expressly agree to be bound by and to comply with all such temporary emergency disaster orders, directives, and advisories. The reason that such a specific provision is important to all of us is that residents of Incline Village and Crystal Bay have made specific requests during this COVID-19 pandemic for actions to be taken by Washoe County to protect us temporarily from the influx of visitors from out of state. Provisions that have been enacted by virtually every other small mountain community in the United States, and we have been told that these cannot be enacted by the county because there is no short-term rental ordinance in place. These requests included our request to temporarily close short-term rentals during the pandemic, as has been done in all of the California local jurisdictions on Lake Tahoe, in Mammoth Lakes, in Sun Valley, etc. And more recently, our request that owners and rental agents be required to post notices in short-term rentals of the governor's and county health officers' 14-day self-quarantine period, social distancing and mask usage. Washoe County needs to have the tools to deal with future emergencies and disasters, whether from pandemics, fire, earthquake, etc. I therefore respectfully request that the short-term rental ordinance be drafted to include a strong and enforceable provision that allows Washoe County to enter temporary orders, directives, and advisories directed to short-term rentals during periods of emergencies and disasters. Thank you for all of your efforts to date and for your continued consideration of this request. And our next public comment is from Carol Black.
Okay.
And this is from Carol Black. She says, attached our public comment
Do
submitted
you want to
to...
start your timer?
Oh, thank you. Attached our public comments submitted for the Washoe County Board of Commissioners meeting on April 21st, 2020. FYI, I focused on two areas of concern. Number one, apparent lack of proactive implementation of the various COVID-19 related orders, advisories, and recommendations in STRs, placing renters, visitors, social support workers, owners, and adjacent residents at added potential avoidable risk. Our thinking is as follows. Washoe County Code references these entities, and Washoe County collects taxes. Nevada and Washoe County and / Washoe County Health Department have issued orders and mandates, including these entities. Washoe County can identify and notice all property owners. Thus, Washoe County Health District can and should facilitate proactive notification of these regulatory mandates through property owners to their agents and renters / visitors who might otherwise be uninformed and unprepared. 2, dissemination of disaggregated testing / outcomes incident data, either by zip code or at a minimum by sub-areas within Washoe County, to support enhanced containment efforts where appropriate and for focused reopening planning when the timing is right and supportive infrastructure is in place to safely allow. We gather that this is in process and look forward to the release of appropriately aggregated and more detailed information. Thanks very much for your consideration, assistance, support, and all that you're doing. Carol Black. And then I have a continued comment here, which I'll read until her time expires. Though COVID-19 models generally focus on states and Washoe County's peak may lag, Nevada's planning is beginning for the time when COVID-19 cases decline and maintain to potentially allow for careful reopening activities consistent with CDC, et cetera, recommendations. Perspectives by Washoe County officials at last Friday's town hall reflect thoughtful attention to competing priorities with an emphasis on ensuring health and safety of the public and business employees. While recognizing the economic implications of the current situation, there was clear focused attention on moving in a thoughtful paced manner, maintaining appropriate preventative measures, e.g. PPE, distancing, cleaning / sanitation. In this context, I raised two concerns. Number one, is very difficult to reconcile the careful perspective addressed above with the apparent lack of current attention to risks associated with STRs. Various advisories and orders have been issued and proactively disseminated / implemented in all other similar essential businesses, but not formally to STR owners and via owners to their renters. Typical implementation steps. That concludes Ms. Black's 3 minutes. I will place the rest of her comments on the record for today's meeting.
Thank you, Madam Clerk. We also now have individuals joining us via Zoom this morning. Signed in first would be Jeff Church. So, Mr. Church, we will unmute your mic and allow you to speak for 3 minutes. So, Mr. Church, the floor is yours.
Thank you very much. Can you hear me?
We can hear you.
Wonderful. Good morning, everyone. I want to make a few comments. I listened to a presentation up at Incline by Commissioner Burke-Bigler. I want to address the entire commission. The commissioner seemed to indicate that the governor could shut down state highways, including 431 leading to Incline and further leading to interstate travel. I hope the commission does not endorse that. The idea of the police shutting down roads for interstate travel or intrastate travel is egregious and unconstitutional. Ms. Burke-Bigler also indicated apparently not in favor of quickly opening businesses, and she was critical of those of us, including myself, that engaged in peaceful protest about our constitutional rights. I remind the commission that the Constitution does not go away because of this virus or because of any edicts or decrees by individuals. In order to curtail constitutional rights, there must be a compelling reason and it must be narrowly focused. Now, we did flatten the curve. That was the intent. The virus is never going to go away, and I hope that the commission endorses safely and reasonably opening businesses as soon as possible, where those businesses may voluntarily open and people may voluntarily attend those businesses. Nobody is forced to. And the same thing goes with church services. And finally, we have an election coming up with mail-in ballots. I hope that we look at those that are undeliverable and study to see who voted in the previous election. It gives us an opportunity to see if there is any voter fraud. But my main concerns, again, are the statements that I heard that are rather outrageous about curtailing our rights to travel within the county or within interstate or intrastate. Thank you very much for your time.
Thank you, Mr. Church. All right, and that concludes Mr. Church's public comment. Next, signed in via Zoom, we have Miss Anne Marie Grant. And so, what's that? Voicemail. So we have a voicemail from Miss Anne Marie Grant, and we will play that for you now and place her comments on the record.
Washoe County Commissioners Meeting for 2120, Agenda Item 3. My name is Anne-Marie Grant. My brother Thomas Purdy was hogtied by Reno PD on 10/4/2015 during a mental health crisis. Instead of getting him medical attention, they hogtied him and dumped him up at Washoe Jail. Instead of the deputies heeding the pleas of my brother for his life, they chose to smother him to death. He was the second in 3 homicides at the hands of deputies at the jail within 1 year. During the period in which all of you were neglecting your duties as county commissioners under NRS 211.020. Are you all aware that the new Sheriff Balaam took 2 $5,000 campaign contributions shortly before Election Day from NAVCare? NAVCare is the jail medical vendor, the same vendor that was being utilized when my brother was killed by deputies, the same vendor when Justin Thompson was killed by deputies. Surely you remember the $500,000 in taxpayer dollars you all signed off on to settle the wrongful death lawsuit filed by his loved ones. NAVCare was the medical vendor when a total of 14 deaths occurred at the jail from 2015 to 2017. It seems the new sheriff is more concerned with lining his pockets than the safety of the inmates. They are truly one of the most vulnerable of Washoe County community members. Their lives are in the hands of deputies and medical staff. Should a subpar medical vendor still be providing care? The correct response is no. I am simply writing you today to tell you to do your jobs under NRS 211.020. Do not feel anyone else like you feel my brother and the other 13+ families who had loved ones die up at that household. It's reassuring to know that you all have not once chosen to put any type of discussion regarding this issue as an agenda item. You should also be looking into why DA Chris Hicks waits sometimes 2 years to release officer-involved shooting reports. Apparently, Nevada needs a law written about this issue because Hicks does whatever he pleases. Think about it. Clark County releases the names of cops involved in shootings within a few days. Again, I'm just asking that you please do your job. There's a COVID-19 going up in the jail. Really, you need to make sure that the inmates are protected.
It looks like the end of Mrs. Anne Marie's voicemail and public comment that she submitted to the clerk. That will be placed on the record. At this time, I see no further public comment, either via Zoom, teleconference, or via email. So with that, we will close public comment and bring it back to the board. Mr. Manager, we are on to item 4.
Item 4, Commissioners and County Managers' announcements, reports and updates to include boards and commissions updates, requests for information, or topics for future agendas. No discussion among commissioners will take place on this item.
Okay, Mr. Manager, do you have anything for us this morning?
Mr. Chair, I do. I want to start off by reminding folks that we will have another virtual town hall meeting concerning the COVID-19 crisis and the region's response. It will take place this Friday at 1 o'clock. This week, the focus will be on Law Enforcement and Public Safety and Mental Health, Chairman Lucy, Sheriff Balaam, and Captain Derek Reed from the Northern Nevada Peer Support Network will all be speaking or participating in this session. Again, that's Friday at 1 o'clock. You can visit the county website for more information on that. Secondly, I just want to update the commissioners that we are in the process of taking a look at scaling down the incident management team, incident command concerning COVID-19. It appears that our numbers, whether it's number of cases or hospital bed utilization, a lot of different metrics that we use to evaluate the status of the emergency are plateauing. And as such, we are making preparations at the appropriate time to transition operations back to our regional emergency operations center and the contacts in Sparks and Reno. As a part of that, we're also beginning planning within the county to make sure that we transition our employees back to work in a safe and thoughtful manner. We're not ready to do that yet, but it takes time to walk through these things and plan, and there's a lot of good planning already underway. So, Mr. Chair, those are my updates for this morning.
Great, thank you. Next, I have Madam Vice Chair Burke-Bigler signed in.
Thank you, Mr. Chair. So in response to a comment that was made earlier by Diane Hirschberg regarding the STR ordinance that we sent back to staff, I have had a conversation with Assistant County Manager Dave Solero, and he said the soonest that could get back on our agenda would be in June. And so I wanted to suggest that we get it back on our agenda as soon as we can with the various changes that the commissioners have wanted to make. And I also do have a copy of a paragraph that I would like the commissioners to consider, and I will submit it to you, Mr. Manager, so that you can get it out to the commissioners regarding whether or not we need to have a paragraph in the new law that says that dictates what we can do during an emergency. In the event we have another emergency like this, what happens to us to allow us to sort of do a better job of protecting people who will live within the basin. Anyway, so I do have all that. I will get that to you. And I would ask that we look at how soon we can get it back on. And I know there's no way we can get it on before the end of June, but if we could look at getting it on at least sometime fairly soon, that would be great. And I also would like to take the opportunity to simply say, I do not advocate that the governor close state highways. I said that the governor is the one who has to do that, not the county. The county cannot say to our sheriff, Mr. Sheriff, send your deputies out to close state highways. That isn't the way this works, and I do not support that. And I don't know what the other issue was that I supposedly said, but I didn't say that either. So perhaps it would be a good idea if people who like to listen in on these conversations really should pick up the phone and call me and ask me if that's what I'm saying before they say it. Thank you.
Okay, thank you, Madam Vice Chair. Commissioner Jung, do you have anything this morning?
Thank you, Mr. Chairman. I do.
The floor is...
I first wanted to say that I wanted to highlight that you as the chairman were the first in the region to call for some social distancing and really alerted everybody else to the potential to use data to flatten that curve. And what I should say to that is congratulations, because we got some good news. We're going to scale back what we had anticipated for, and that to me is because of your leadership and your ability to convey this in a way that was unalarmist but stern. And you flattened the curve, and I lay that at your feet. I lay that at the regional joint communications team, and most importantly to the district health officer in coordination with you. So we all could use some good news today, and I think that was some pretty fantastic news from the manager. So thank you for that. I'm glad that you're the chair, and I'm glad that you did that. The second thing that I'd like to have brought to this, that's not to bring to the board. The second thing I have to say, and it might need to be brought to the board, if we're transitioning employees back to work, what is the work from home policy and plan? And it's specifically on continuing that option and expanding that option. I don't think we should all go back to normal when we are finding successes or perhaps failures, but we need a whole report on that before we go back to the standard operating procedure. And then I have a general question overall. I need to know from the attorney what constitutes an emergency item on an agenda, and what is the turnaround time and staff time if I wanted to call an emergency item for an agenda or a special meeting. So I need all those things. You don't have to tell me right now, Mr. Edwards, but if you could just write us an email citing everything, because I have an idea that maybe if we have the possibility to do this, I'd like to think further about. And that is all I have. Thank you, Mr. Chairman.
Thank you, Commissioner John. I appreciate that, and thank you for the kind comments. Commissioner Hartung.
Thank you, Mr. Chair. I've just got a few things this morning. One, I'm wondering if we can put a short agenda item on the next agenda to send a letter to the hospitals asking them to defer sending people to collections right now. I mean, I've gotten several calls where people are being sent to collections because they can't afford to pay the bills, and they say all you need to do is contact the hospital, but I think it would be nice to just send them a letter. And the second thing is I've also been getting, and maybe many of you have been getting the same thing, I've been getting a number of calls from their spoof, of course, from the IRS and Social Security, which are not true in any way, shape, or form. They're telling me that there's an issue with my account. I don't have a Social Security account. I mean, these are. I'm sure that they're going out in blanket. I'd like to remind people that the IRS and the Social Security Administration will not contact you this way. They use other means. And then the last thing, Mr. Chair, I sent both you and the manager the plan that Denver is using to roll out golf courses again safely. I've been discussing with the manager and with the mayor about having a working group made up of medical professionals, business owners, and medical professionals would include people like infectious disease epidemiologists and people from the health department, to give the governor some thoughts on how we phase reopening of businesses. We've got to do this as quickly as possible. We've got to get people back to work, but we obviously have to do it in a safe manner where everyone is protected. And that's all I have, Mr. Chairman. Thank you.
Thank you, Commissioner Hartung. Commissioner Herman, do you have anything this morning you'd like to add? Okay. A couple things I want to add. First and foremost, I want to go back and identify, at the last meeting, last Tuesday, we had some donations that the commissioners do when we do our district funds allocations every year. And we, I think in the midst of the business that we were trying to get through that day, we overlooked those. And I want to take a step back and point out that last meeting, Commissioner Jung did identify funds out of her commission district special fund disbursements to the amount of $20,000. She donated $14,000 to a grant to the University of Nevada, Reno Foundation to support senior outreach services. She also gave $5,000 grant to Truckee Meadows Parks Foundation to support participation in Washoe County employees in the Truckee Meadows Trails Challenge. And then she gave $1,000 to Washoe County Human Services to support the purchase of gift cards for basic needs for community members that have been affected by the COVID-19 pandemic. So Commissioner Jung, I want to make sure we got that on the record for you and worked on that for you as well. I also donated $10,000 of my funds to $5,000 to the Community Foundation of Western Nevada to support Food for Heroes Fund, which donates food and meals to frontline workers at the hospitals and during the COVID-19 pandemic. And then I gave $5,000 to Friends of Washoe County Library to support South Valley's library STEAM program to move forward. So we did not outline those, so I wanted to make sure we did that first and foremost. You know, I'd like to make the comment, I think that Commissioner Jung puts a lot on, gives a lot of credit to me, but realistically, this address, how we have done this, has been the county's approach to working together. It does show a regional collective effort, but you know, counties are best suited to deal with emergencies. This is what we do. Counties are always there to make sure that our citizens, whether you live within the city or an incorporated area, this is how we address these kinds of situations. We're the best suited to do that, and we're happy to stand up when those emergencies happen, and we're called to action. But it isn't without the guidance of our manager, the collective support of the commission, and all the staff members that work tirelessly to address this concern day in and day out that allow us to do such things as flatten the curve. And I think people forget the importance of what a county plays in these types of roles. So I'm very happy. I agree with Commissioner Jung. I think that, you know, we have done a really good job in regards to social distancing and the processes of wearing face coverings and washing your hands and maintaining levels of hygiene that have allowed us to flatten the curve too. And we are seeing positive results from those measures. I think now we are moving into the second tier of our response, which is how do we collectively work together to reopen? I think that is what we need to start planning. As you heard from Commissioner Hartung, plans to work on opening golf courses, plans. I've spoken to many businesses, both within the city of Reno, city of Sparks, also in the unincorporated, that are gearing up and wanting to know, but what is the plan? What does that new normal look like? You know, Commissioner Jung pointed it out. What is the new normal? How do we write policy based around that? And I think what we should be doing is putting plans together to identify what those new normals are, what the regulations we need to probably relax on from a number of our departments so that maybe businesses can be innovative and creative with the way they go back to business and how they do business, you know, whether that's masks and coverings, whether that's placing things in entryways or restricting access in and out so that they can control numbers within their stores. I think those are the things that we need to be, and what are the new policies? So I think those are the plans that we should be putting together that work for Washoe County and benefit Washoe County and all the entities within us, but also at the same time and submitting those to the state with our recommendations about what we think is best for us, because we are the best suited to do that. We are the best suited to understand our community and our constituents and the businesses that work here. So I think those are important things to discuss, because the frustrations now are high and small businesses are suffering, and we need to get those individuals back online sooner rather than later. So with that, Commissioner Herman, I have you signed in.
I was just wondering why you mentioned 2 commissioners' donations, but not the 3rd.
Did I? Oh, I'm sorry, Commissioner Herman. I didn't read down to the next line of the page. I apologize. And Commissioner Herman was not identified. Hers also. Commissioner Herman did have disbursements, and I apologize, Commissioner Herman. I did not read for enough. Commissioner Herman did disbursements of $17,000 from her special fund disbursements. She gave $1,500 to the Nevada State High School Rodeo Association to Washoe County High School Rodeo Club. She gave $1,500 grant to the Board of Regents for University of Nevada support Washoe County 4-H livestock leaders for youth members as they pursue their personal goals and learn about the livestock industry. She gave $2,000 grant to Saving Grace Academy to support the purchase of daycare equipment and Washoe County permits. She gave a $5,000 grant to the Food Bank of Northern Nevada, purchase food and to aid the organization's COVID-19 response. She gave $5,000 to Washoe County Emergency Management to purchase PPE or personal protective equipment to provide for first responders and medical professionals responding to COVID-19. And then she gave $2,000 to grant a $2,000 grant to the Salvation Army of Washoe County to support Reno Man's adult rehabilitation program and approve any the resolutions to make those changes. Commissioner, I absolutely apologize. It did not look far enough. I'm sorry about that. But Matt, I'm glad we were able to get that into the record for you, and I appreciate all the commissioners' continued support. Like I said, this does take a commission's response, not just one of us. So with that, seeing no further announcements this morning, we will close the announcements and we will move on to item 5. This is an appearance by Washoe County District Health Officer Kevin Dick in regards to the COVID-19 response. And so I believe Mr. Kevin Dick, our Health District Office, is with us via Zoom this morning. So we will turn this over to Mr. Dick for a brief presentation in regards to the COVID-19 response. Mr. Dick.
Good morning, Chair Lucy and Commissioners. Can you confirm that you're hearing me okay?
We got you loud and clear. Thank you, sir.
All right, thank you. I just would like to begin with thanking you, Chair Lucy, and the Commissioners for your partnership and support as we address this global pandemic crisis and the support of our regional partners working together with the Health District in this response. I do have an update for you as to number of cases that we have to date. As of yesterday, our latest update, we had 25 new cases that we reported. We're at 662 total cases of COVID-19 in Washoe County. Sadly, we've experienced 18 deaths of our residents from this outbreak. We have 166 people who have recovered. We have 477 active cases. Of those, 43 individuals are hospitalized, and we've had 37 individuals who've been released from the hospitals. The hospitals continue to have good capacity. The number of licensed and staffed acute care beds that were occupied in our short-term care hospitals as of Sunday, the 19th, was 55% of the beds. We had 56% of ICU beds occupied, and 24% of the ventilators available were in use. The Health District continues to operate a call center in conjunction with REMSA and to both over the phone and through a web-based portal conduct risk assessments and scheduling of people for COVID testing. Both the phone center and the website portal are providing both English and Spanish options for people to go through the risk assessment process. And I wanted to also emphasize that the testing is free and we don't require any information regarding immigrant status, no information required in regard to health insurance coverage, et cetera. We really want people to be contacting us if they have symptoms so that we can get them scheduled for COVID-19 testing. We're also doing the drive-through post where we collect the specimens for testing at the State Public Health Lab. And we operated the post yesterday and tested 217 individuals there, and we'll be resuming testing on Wednesday and then Friday and Saturday as well. The couple of things to point out is that we have a number of county employees from other departments that have volunteered to assist us with the call center staffing. And so we appreciate their contribution toward our efforts. And we also have now the National Guard has joined us and are integrated with our testing at the post, as well as our work with the call center and with our contact tracing work moving forward. So there were some remarks made about the flattening of the curve, and we are cautiously optimistic right now as we look at the number of new cases that we're reporting on a daily basis. And we look at some of the models and projections that have been developed. One of the models that we're looking at is the Los Alamos National Lab model for the state of Nevada. And that model was updated on Sunday. They updated it from earlier the week before. They had said there was about an 80% chance that we had already reached our peak in Washoe County as of the 15th of April, and about a 20% chance that we hadn't reached the peak. They adjusted that just slightly to say that there was an 82% chance that we had reached our peak by Sunday the 19th, and a 18% chance that we hadn't reached the peak. If we haven't reached the peak yet, they also provided a projection that the highest potential for reaching the peak, if it occurs at a future date, is sometime this week. And the next highest percentage would be the following week. So they predicted, if we haven't yet reached the peak, their prediction was a 25%, actually about 26 or 27% chance that the peak occurs this week, about a 21% chance that it occurs the following week, and then declining probabilities of it occurring in the future weeks. So both based upon our data and this model that we think has been tracking our actual conditions and what we've reported, we do believe that we may be plateauing with the number of cases. However, it's very important to recognize that while it's great if we're plateauing and we're not having a continuing increase in the number of cases that we're reporting on a daily basis, that also means that we have more cases occurring right now than we have to date in our experience with this COVID outbreak. And so it's very important for people to be vigilant now and continue to practice social distancing, to stay home unless they have an essential need to go out, to only be operating essential businesses, and for people to be ensuring that they're covering their faces when they're in essential businesses. They're continuing to maintain that social distancing, that they're washing their hands frequently, using hand sanitizer, and continuous cleaning of high contact surfaces, so we can continue to work to reduce the spread while we're aware that now we have the highest number of cases that we've experienced so far basically occurring during this last week and continuing forward. So we need to be vigilant, and we'll continue to track these numbers, and we need to hopefully be able to document a continuing decline in these numbers so that we're reducing the number of cases and the spread that's occurring in our community versus having a plateau or remain flat with continuing transmission at these levels. We are also looking at the future and the transition that can occur if we do see that decline in cases that are continuing, and in how we manage this pandemic to try to be able to reopen the economy while still controlling the spread of the disease so that we don't have another surge coming ahead of us. So the approach for this is a approach where we're really trying to make sure that we're boxing in COVID-19, and that's there's a box it in strategy that the former CDC director, Dr. Tom Frieden, has laid out, and it's basically it's to test widely, to isolate infected people that we identify through that testing, that we find everyone who's been in contact with infected people, and that we quarantine all of those people that are contacts for that 14-day incubation period, so that if they do become symptomatic, they can be isolated and they're not infecting people in the meantime if they have been infected and are developing the disease. This framework works in conjunction with gradually opening different types of businesses in a way that we can monitor the number of cases that are occurring in our community through this testing strategy, so that if we do start to see increases and additional surge developing, we can react to that and slow down the pace of that reopening activity that's occurring. So I think that some of the description that Commissioner Hartung provided of working regionally with ideas of what makes sense for us as far as the strategy for types of businesses that should be considered first in reopening, the types of practices that should be used to work to limit the spread as those businesses are opened, are important discussions to be having, and to be able to provide input to the governor as he works on the state strategy for opening up the economy, but doing it in a thoughtful and cautious way to avoid additional impacts of this disease to our residents, and control and manage that the level of the disease occurring in our population. The Harvard University has put out some recommendations for the level of testing that they think will be needed as we reopen our economies and ease the restrictions that we've put with the business closures and the staying at home mandates. And their number is 152 tests per day per 100,000 population. And so that would be about 700 tests per day occurring in Washoe County. Currently, we're averaging between the Nevada State Public Health Labs testing and other commercial lab testing that's occurring through healthcare providers collecting samples. We're currently at about 240 tests that are being conducted a day, just looking at the last week. So that's about 52 tests per 100,000 versus the 152 tests per 100,000 that Harvard is recommending would be needed as we go to reopening our society. So we need to develop additional testing capacity, and you're hearing that discussion happening at nationally, how we can get more testing available. We do have 4 Abbott ID Now rapid testing units that have been provided in Washoe County that we have deployed to renowned St. Mary's and Northern Nevada medical centers and to Community Health Alliance that provide a 15-minute test But we have very limited supply of the cartridges that are used for the testing for those test kits. But as that capacity can be increased, the promise of the rapid ID type test is that they can be deployed to point of care testing. So as more become available, ideally they would be distributed out to medical practices throughout our community, and people could get tested similar to the way they do with flu, with the rapid flu test. Other work that's occurring on testing is with the development of antibody tests, which could identify if somebody has been infected and developed antibodies for COVID-19. And we don't yet know how effective and specific those tests are to be able to identify COVID-19 and not have false positives that somebody was infected with COVID-19 when in fact maybe it was another type of common cold coronavirus. But the state lab has got some of those tests that they are going to be working to validate this week, and so hopefully we'll have some better information about how those tests perform from the work that the state lab's doing. So testing is one key element of what we need to support reopening and moving forward. The other key need is the workforce that is to conduct that case contact investigation, to be able to, one, have anybody who is tested and is positive to be isolated so they don't infect other people, and two, identifying those close contacts and ensuring that those individuals can be quarantined so that they aren't infecting other people. And the ASTO and NACCHO have ASTO's the Association of State and Territorial Health Officers, NACCHO's the National Association of County and City Health Officers. They have both put forward position papers and worked in conjunction with Johns Hopkins on what that workforce capacity would be to do that contact tracing. And they've estimated about 100,000 people nationally involved in that initiative, which would mean about 140 people providing that contact tracing here in Washoe County. And they've also put forward a federal funding request of $3.6 billion to be provided to state and local health departments to be able to have the resources to bring in that workforce. So that's a challenge for us moving forward as well. And then I think the other key piece that we need to address is if we're opening up our community and the protection that we provide and the way that we fight COVID-19 is to make sure that we're identifying and isolating people that are infected and quarantining those that have been exposed, that's an effective strategy that actually results in those people being isolated or being quarantined and not being out and spreading the disease in the community. So I think we need to work to strengthen our capability of enforcing that isolation and quarantine to be effective in this moving forward, because we won't have that other layer of protection that's the stay-at-home and social distancing practices, the stringent ones that we have in place. But even as we're opening up and moving forward, we still will need social distancing measures. We'll need those practices in the workplaces that need to be observed to be able to prevent spread of disease until we get to the point where we have a vaccine that's available, which is really what will bring us out of this in the end. to be able to have the ability to have people vaccinated so that we have the herd immunity and protection for everybody in our community. So that's my update for you. I'd be happy to take any questions or have further discussion.
Great, thank you, Mr. Dick. I know Commissioner Jung had some questions for you. Commissioner Jung.
Thank you, Mr. Chairman, and thank you, District Health Officer Dick. I have a few questions, and I'm going to just go in the order of your presentation. I have a question, a broad stroke question about this, and it might be something we need to discuss at a later date, and it might be even qualify for an emergency agenda item or an emergency meeting. And here's my question, and maybe it's just a report to us too. When it comes to us discussing FEMA, the Army Corps of Engineers, I'm not sure about the National Guard, they always come with a price tag. And here's my broad strokes question. Why are we getting taxed twice? That's all of our federal income tax that we pay. That's my money. So then they come back and say, yes, we'll help you, but now you owe us again. So I want to know how they are able to doubly tax us for that. And then I'm glad you talked about the case contact investigators, Mr. Dick, and the pipeline. Are we working with Truckee Meadows Community College to use their emergency orders to recruit and train within like a 4-week program so that we can have case investigators? Because according to you, we're going to get 100, sorry, I didn't write that number down, a good amount. And I don't think that we need to do this through a curriculum committee and all the stuff that happens in academia or certification programs. How can we get this done the most quick way using emergency curriculum, et cetera, and I would say PMCC is the most able to do this, but I don't really care who you reach out to. Maybe it's Job Corps, maybe it's some other agencies, but I think that needs to get done, and we need to be talking about that. And then since we can't, it looks like we'd have to ramp up 3 times the amount of testing per day to get to the place where we would feel that we could really apply data to our opening up and relaxing some of the more stringent requirements that did help flatten the curve. But I also need an agenda item or a team or a regional meeting about what are we going to do instead of hoping and sending thoughts and prayers that tests are available. There has to be some different trigger points that we're going to have to live without testing to do a modicum of being able to open up and still be able to say, and we are keeping your health and safety in mind. So, and that goes right back to the contact investigators. I know that's part of it, but we need to also learn a little bit how to do this without a net, because we've been told, and every single one of us have tried, I'm sure, to get a hold of something in that supply chain, and we can't get it. So I don't want to keep saying, well, when we can get these tests, I want to know, what if we don't get the tests till September? What can we reasonably teach people to do? Because my biggest fear is that people are not going to love and support and respect all the social isolation and will just be yahoos and do what they want, where if we can incrementally start, recognizing that psychological, spiritual, mental, physical needs with the science that is available. So I would like to have an update on that. And so that'll just wrap that up. Let me just wrap that up. I just need to know what are alternatives to not ever getting enough tests, before the next weather season, which usually tracks with infectious disease for various and sundry reasons. So I need all that stuff because I'm no longer going to wish for things to be a certain way, and would rather that have staff come up with some contingency recommendations based on the absence of this supply chain ever getting fixed before this September. Thank you, Mr. Chairman.
Thank you, Commissioner Jung. Commissioner Hartung, you had a quick question. I do want to move on. We have been on this for a minute, so go ahead, Commissioner Hartung.
Yeah, and I'll make them brief. To Mr. Dick's point, this is going to be very difficult to roll out businesses because they're not just cookie cutter. A business like a large box, retailer of furniture is different than a hair salon, is different than a car dealer, is different than a restaurant, is different than a jewelry store. Some of the preliminary conversations that we've had with respect to contact tracing, and it's not a fun way to do it until we get an app where we can really monitor this easily, but it may come down to business owners having to keep lists of patrons and times that patrons were in their business. I know that's a difficult way to do business, but I mean, what we're trying to do is talk through all of the possible solutions until we can come up with one that's viable, or a number of them that are viable, pertaining to a lot of different business models. And so this is not going to be easy, but we do need to make suggestions to the governor as quickly as possible, so that, and I know he understands this, but the state is very diverse, and we're very different than Las Vegas, as is very different than Eureka or Elko or Winnemucca. So we're going to have to come up with some type of plan that sort of recognizes those demographics.
Thank you, Commissioner Hartung. Commissioner Herman.
Okay, so thank you, Mr. Chair. I think we need to kind of give some of the people a break that are in business, and like in other states where they've been free to make those decisions, like South Dakota, I believe it is, they're doing quite well. Businesses, they're going to be welcoming being able to be open again and not having to go completely bankrupt. And I think that we need to give them a chance. The private sector needs a break on this. People need to get out of their homes and get back to work.
Right.
Everybody's going to lose in the long run. The longer we stall this and make it harder, because it's not as complex as we think. And we are not all business people here on this board, and neither are the people in the health department or any different department of our county. But we have to give the people a chance. We need to lighten up a little. I mean, we need to get this thing, the show on the road again, or we will be the bad guys.
Yeah.
Okay.
Thank you, Commissioner Herman. I want to thank everybody for chiming in on this. And so I'm going to bring it back to the board, and we're going to move on. Mr. Dick, thank you for your presentation today. I do appreciate it. We do have, I'm going to take something out of order. We have some individuals joining us for item 10, which is the discussion and possible direction of Washoe County District Attorney's Office to file an amicus brief. We have some individuals, so I'm going to open 10 and take this out of order, just in the appreciation and respect to time for these individuals that have joined us on the Zoom meeting. So with that, Mr. Manager, will you open item 10 for us?
Sure. Item 10 is a discussion and possible direction to the Washoe County District Attorney's Office to file an amicus or similar legal brief on behalf of the county in support of the Nevada Osteopathic Medical Associations and Dr. Bruce Fong's legal challenge to the Nevada State Board of Pharmacy's March 23rd, 2020 emergency regulation banning chloroquine or hydroxychloroquine prescriptions for the treatment of COVID-19 except in cases of hospitalization.
Perfect.
An amicus brief is a document submitted by a non-party to a lawsuit that is intended to outline legal arguments and authorities for the benefit of the court in ruling on the legal issues involved. NOMA presented its challenge by letter to the BOP on April 9th, 2020, asking it to pass upon the validity of the regulation pursuant to NRS 2338.110, excuse me, and asserting, excuse me, among other things, that there has been no basis demonstrated to pass the regulation on an emergency basis, that the regulation is preempted by federal law, and that the regulation constitutes the unauthorized practice of medicine by the BOP. My goodness. Where was that? But by the BOP.
And that it violates the statutory constitutional rights and doctors of their patients. We don't, I'll stop. We don't really need to read it all in. I'll let Mr. Edwards continue on. So Mr. Edwards, it's okay, Mr. Manager. He's having a sneezing fit right now. So Mr. Edwards, you are joining us this morning via Zoom. Can you please give us your presentation in regards to the position of this item, sir?
Yes, this relates, let me first confirm that you can hear me so I don't.
Yes, you're live. Go ahead, we can hear you.
Great. Yes, this concerns an emergency regulation adopted by the Nevada State Board of Pharmacy on March 23rd, 2020. And in that regulation, what they did was they banned prescriptions of chloroquine and hydroxychloroquine for the treatment of COVID-19 for cases of hospitalization. And so the way they
Hold on, Nate. Can we mute the other members right now? All right. Go ahead, Mr. Edwards.
Yes. So they banned the prescriptions of these drugs for the treatment of COVID-19, except for patients who are hospitalized and have a chart order by their doctors at the hospital to treat it. This led to a letter by you, Mr. Chair, to the Board of Pharmacy and the governor on March 31st of this year, asking them to ease the restriction to allow licensed physicians to prescribe these drugs to treat COVID-19 if you have an actual diagnosis, regardless of hospitalization, and the primary theory behind that being that that would be a decision for patients and their doctors to make between themselves, and that it would provide an alternative to people having to seek treatment in the ER and lessen traffic there and exposure to healthcare providers, decrease the rate of infection spread and those types of things. Significantly, the letter that you sent to the Board of Pharmacy and the governor also came on the heels of an FDA emergency use authorization allowing these drugs to be used, specifically recognizing the usability of these drugs and their likely efficacy and safety for treatment of COVID-19. In certain circumstances, they tied their decision primarily to the national stockpile supply of these drugs, which are, as I understand it, under the federal system to be made available to hospitals throughout the country and sent out in that way to help them deal with any supply issues or anything like that. After your letter, the Board of Pharmacy did issue or their staff in any event, did issue a waiver originally on April 7th of 2020 that rolled back the restriction to allow emergency room doctors to treat with these drugs on an outpatient basis, but it still excludes primary care practitioners. The Nevada Osteopathic Medical Association and its president, Dr. Bruce Fong, submitted a challenge to the validity of the rule via letter dated April 9th of 2020 to the Board of Pharmacy and the governor, asking them to eliminate the additional restriction to allow primary care physicians outside of the hospital setting to prescribe this drug to treat people for an actual diagnosis. Dr. Fong, I believe, is on the line today to speak. I think Dr. Callister is available to speak today as well. Joey Gilbert's office is the law firm that filed the challenge with the Board of Pharmacy. And as I understand it, they're planning on filing a complaint to challenge it in court since there was no movement on the restriction after that was filed. And I think the doctors can provide some pretty helpful information about their perspective on why it's preferable to have primary care physicians be able to use these drugs to treat if they wish. I think it's also important to point out that their challenge is not in any way meant to require anyone to treat with these drugs or require any doctors to treat with these drugs. Rather, it's to return the decision to the doctors and their patients themselves rather than the government making that decision for them.
Great.
There are a number of grounds for the legal challenge that were stated in Mr. Gilbert's letter to the Board of Pharmacy. I'm happy to answer questions about those, but I don't want to, sit here and rehash or restate every one of them.
No,
Summarize
that's good, Mr. Edwards. I appreciate that. I think you've given us the opportunity for that. So
yes. So I'm available then for any additional questions. I will say that from the county standpoint here, in the staff report, I highlighted some of the interest that the county has in this scenario. And the county's position here would be as a non-party, asking the court to accept the brief saying, what the arguments are from the county's perspective and shedding some light on it for the court.
great. So I did ask, as the chairman, to have this item placed on and amend the agenda for today based upon the need for this. My reasoning behind that, based upon my letter submitted to the governor's office dated March 26th and then submitted on the 31st with some amendments to that, was that we in our missions have always prided ourselves on maintaining a safe, secure, and healthy community. And through this response, as I've noted earlier, the county does become the frontline provider for all finances in response to any emergency situation. And continuously, we have sat here and expressed to people to stay home and take care of themselves through the possibility, if they were to get it, to stay home and self-isolate. However, we have seen, anecdotally, that this drug does help in combination with azithromycin, and so that was our extension to the pharmacy board, was to just back this up just ever so slightly, so that if an individual with a positive test could contact their primary care physician and get a small prescription to this drug. And so I think from a standpoint of the county's drive, that this is the ability for us to protect our community and our individuals financially through our response, so that we don't inundate our hospitals and continue to increase this, but allow all our providers that have been medically trained to continue to service their patients and not allow the government to come between the patients and their staff. So those are my comments on this. I know we have Dr. Fong on the phone, so I'm going to go to them first, and then we can fill in. So, Dr. Fong, if you're joining us, I'm going to unmute you and have you add your comments, sir, and we'll just bring that to 3 minutes if you can keep it brief for us. Thank you, sir.
I go first, or would you like to Dr. Fong first?
Okay, Joey, if you want to go ahead and go first, and then we'll let Dr. Fong. Joey, your audio's a little fuzzy. If you could clear that up for us, or something with yours. Go ahead. Mr. Gilbert. Joe, are you there? Can you hear us?
I can hear you loud and clear.
Oh, good. We got you now. Good. Much better.
Okay, can everyone hear me then?
Yes.
Okay, so guys, real quick backing up. Yes, this is Joey Gilbert. I have filed a petition with the governor's office asking for him to reverse the emergency regulation. First and foremost, because there was never an emergency, there was never a stockpiling, there was a worry, there was less than 19 concerns or letters sent in about possible licensees stockpiling, but that never happened. We had a shortage, and we do not have a shortage to this day. I have spoken to all the big chain pharmacies. We can get it here, and it has been the governor's ban that has produced this shortfall and continues to produce it. Now, I want to just say this. We've already heard from the county, absolutely, testing, medication and testing. Testing, quarantine those people that have it, and then anyone that's got the symptoms but's not positive stays quarantined and tested again. Then back to the testing and safety protocols. The use of hydroxychloroquine, which is proven to be the most effective by thousands of doctors worldwide and hundreds in the US, both New York and Michigan have both requested additional hydroxychloroquine from the federal government when they first initially banned it. Why is hydroxychloroquine so important? It kills the virus by not allowing it to reproduce itself. I won't get into all that, but most importantly, it's less time people are infected, less progressed symptoms, and then we're saving lives. Introducing HDC or hydroxychloroquine or chloroquine into the mix early upon confirmation of a positive test is truly a life or death decision for many of our high-risk community, and ER doctors have locally now recognized and asked that hydroxychloroquine be used early or before the patient deteriorates, and any hospital or ventilation then used after will be futile or fatal. Meaning 80% that go in on a ventilator don't come off. All right, that is a bad deal. The governor needs to reverse his ridiculous knee-jerk political ban on chloroquine and hydroxychloroquine immediately and allow all doctors, prescribers, and practitioners to call this person in and have it filled by local pharmacies for anyone with a positive coronavirus test and progressed symptoms. And no one is in a better position to make that decision than the patient-doctor relationship. To disallow access to this medicine until at such a time as they need to be admitted to a hospital is cruel, unconscionable, and very likely illegal and will carry liability. Considering what we know now about the virus and what our own county and emergency managers have recommended, which is access to HCD quickly and as soon as the patient has been diagnosed positive and progressed symptoms, has got to happen, or we won't just have 18 deaths here, we'll have hundreds of deaths. So that's my point, and I just want to say that originally they were looking at this wrong, and the coronavirus attacks the hemoglobin and allows the iron ion out, so it can't carry O2. So what they're doing when they're max ventilating, they're pressure ventilating the lungs, are actually doing more damage. This is a simple medication that, if it's introduced in the therapeutic use window, which Dr. Fong will cover next, will save lives and prevent an overrun of our healthcare system and keep our emergency rooms free. They should be dispensing it at local pharmacies and at urgent cares. With that, I will.
Thank you, Mr. Gilbert. We appreciate you joining us this morning. Next, we have Dr. Fong. I believe Dr. Fong is on the phone as well.
Yes, sir.
Welcome, Dr. Fong.
Yes, can you hear me?
Yes, go ahead.
Ladies and gentlemen of the commission, thank you for giving me an opportunity to speak here. My name is Bruce Foam, the president of the Nevada Osteopathic Medical Association, and I bring to you a very major issue near and dear to my heart, because I got muted by you guys. Okay, sorry, I got muted there for a second. Anyway, the long and short of it is we, of course, have had this COVID-19 pandemic dropped upon us. And from the earliest days, I've been trying to stay abreast of it, like every other good doctor tries to see the research. I can tell you new things come up almost overnight on this thing. Having been lecturing in early March about it, within 2 weeks, I was changing huge amounts of my lecture materials. Above and beyond that, now, if I were to look at it, I'd say about 20 to 30% of my lecture is already obsolete, but the bottom line is we're learning more and more. We're keeping things going. We know that around the world, tens of thousands of case reports are coming in that talk about using this medication. In fact, I'd say 9 out of 10 treatment protocols around the world also would also include this particular medication, and all have shown good results. But most importantly, what's actually coming out now is that just like any other condition, you don't wait till somebody's so sick that they need to be in the hospital before you treat them. The earlier you treat them, in this particular case, where somebody is post-isolation and not getting better, and mind you, there's 80+% people that get better on their own, so we're not talking about them. We're talking about that 15 to 20% that don't get better on their own. Those are the patients that we're talking about wanting to treat. Those are the ones that can have this horrible progressions and slide down a slippery slope where they have massive immunologic damage to their system. They have damage to their lungs. They have damage to potentially the hemoglobin, which is the ability to carry oxygen in your blood. All these things happen if we let this thing get out of control and get to a point where somebody ends up needing to get in the hospital. And as Joey very aptly said, we have a dismal survival rate if somebody gets on that ventilator. If somebody gets on that ventilator, you have a 20% chance of surviving, and that's it.
And lung problems for the rest of your
And
life.
exactly, it's chronic lung problem. And so what we're asking for really is compassionately, we as the physicians that normally see the patients as an outpatient who've established a relationship with that patient long-term, have a better understanding what that patient is supposed to look like. We feel that we have a better gauge of being able to say, I think, Mr. Jones, Mr. Smith, hey, it's time, we got to get you on this medicine. I think you're getting worse. We don't want you going down that slippery slope that's going to kill you. So again, we appreciate you considering filing this brief with us. And we really think that therapeutic window is being missed with the current strategies that are being employed at this time.
Great, thank you, Mr. Fong. We appreciate your comment. And then last on the public comment, I have Dr. Callister signed in.
Yes, Dr. Brian Collister here. Can you hear me all right?
Yes.
Okay, thank you for hearing me this morning. I'm the Nevada governor for the American College of Physicians. I'm also a professor of medicine, and I wanted to briefly walk you through why it's so important on several levels that we join this and get the governor to change this ridiculous executive order. You mentioned earlier, Chairman, that some of the information on hydroxychloroquine was anecdotal. It's really, I would say, contradictory. But the sad part is the contradictions in the studies seem to be amplified by which political persuasions you're with. You'll read one news source that says, oh, the studies from France say it doesn't work. You read another news source that says the studies from France say it does work. Well, let me break that down for you. It has to do with the mechanism of the drug. If you'll bear with me for a moment, old professor here. Hydroxychloroquine works by acting as what we call an ionosphere. And what that does is that blocks the virus from entering the cell. In particular here, what's important is the virus doesn't get into the cells in the lung. And there are receptors in the lung that hydroxychloroquine helps block. So intuitively, from a scientific perspective, it makes sense. The sooner you block those receptors, the better chance you have of not becoming critically ill. So the idea is to keep people from progressing from mild to moderate illness to critically ill with ARDS, where they're on the ventilator and they have a 50 to 80% chance of dying. So far, it's been 80%. In the best case scenario, it's 50%. So the governor's order, in addition to taking my ability as a physician and every physician, taking my ability to work with what's best for my patient away from me, has got this exactly backwards. And our critical care friends will tell you, given the hydroxychloroquine in the hospital setting, it's too little, too late, quite often. And what we need to do is start it early. The other thing the governor and his people did not consider with this is the perverse incentive they've created to send people in droves to the ER if they're sick. If I have an 80-year-old patient, for example, with mild to moderate symptoms on the outpatient side, and she tests positive for corona, I need to have this in my arsenal to treat her with. And my goal is she would be a high-risk person who, if she gets to the point of needing ICU ventilation, she would likely die. So let's break this down a little bit, why the studies are contradictory. And let me tell you this briefly. The one French study that said it was ineffective, that was 118 patients, they started that 48 hours, they started the medicine 48 hours after hospital admission on average. So that's too little, too late. That's why it didn't work. The other French study, which showed benefit, where they started the hydroxychloroquine early, they had 62 patients. 31 got hydroxychloroquine, 31 didn't. In the group who did not get hydroxychloroquine,
Mr.
crashed and burned and got admitted to the ICU.
Dr. Callister, can you hear me?
Yes.
If you could conclude your 3 minutes have been up, if you could conclude your thought for me, that'd be great.
Okay. In conclusion, starting this early has been proven by not only the French, but by the South Koreans, who have a 1% case fatality rate. If we want to limit the number of patients in our hospitals, let alone those that are in the ICU, on the ventilator and dying, this drug needs to be started early in patients who are COVID positive and symptomatic and can still stay at home. It will prevent them from progressing.
Thank you.
Thank you very much.
Thank you, sir. I appreciate it. Next, I have Mr. Cliff Lowe.
Good morning, Commissioners. Can you hear me?
Yes, we can. Mr. Lowe, the floor is yours.
Thank you, Mr. Chairman. I happen to be talking about this item only because I was perusing the agenda for today's meeting and was just amazed to see this on the agenda for the Washoe County Commission. I've listened carefully to the comment offered by the two doctors and the Attorney Gilbert and Mr. Gilbert, and I think they have a strong case here. They have legitimate points. But I really have to question, is this something for the Washoe County Commission to get involved in? Do you really want to open Pandora's box? Do you really want to take a stand on this particular item that questions the authority of the state, where the state has acted in many regards to restrict activities that violate laws and would seem to violate the United States Constitution? I would think that the commissioners have a lot of things to do, a lot of matters to deal with without getting involved in something that is largely a national controversy. And if you seek to take a position on this, then I think you're opening up Pandora's box to have people seek to use the county commission as a forum to hear complaints and follow up on lawsuits on a whole variety of topics that have nothing to do with this. I mean, I'm, as much as the next person, don't want to see government restricting individual rights and government being intrusive in our lives. But I really question whether this is something, and encourage you, as sympathetic as you may be to the case here, to not take a position on this. I don't think anybody on the commission is a doctor. This is largely a medical matter, and I would ask you to defer action on this, lest you want to hear maybe somebody show up and complain about they can't go to their church and meet with a group of people, and they want you to file an amicus brief in support of a case to cause the governor to rescind his directive that deals in that matter. Thank you.
Thank you, Mr. Lowe. I appreciate that. I do have Mr. Warren Gilbert signed in. Dr. Warren Gilbert.
Yes, I'm here.
Welcome, Mr. Gilbert. You have the floor. You have 3 minutes, sir.
All right, thank you. I am a 70-year-old physician in Reno, and I'm also a coronavirus COVID-19 survivor. I agree with everything that my son Joey Gilbert, as well as Dr. Fong and Dr. Callister said. I believe I was exposed to the virus when I was in Las Vegas in mid-March. On Friday, March 20th, I started developing a mild fever and a headache. By the next day, my fever shot up to almost 103. My headache got worse, and I developed a cough.
I was aware of the use of hydroxychloroquine around the world, most notably in France at that time. And so I called a pharmacy immediately and got on the hydroxychloroquine Z-Pack regimen. Actually, I first called the Board of Health and had a COVID-19 test performed on Monday, March 23rd. And within 5 hours of having the test performed, I was called and told it was positive, which is why I called the pharmacy. Within 3 hours of taking the first dose of the hydroxychloroquine, my fever and headache were gone and never returned. The cough I had also improved and turned into a mild bronchitis, which resolved over about 10 days. I finished the 2-week course of therapy, and a week after I finished the course, I had another COVID-19 test performed, which was negative. And I had that repeated several days later, since I'm a provider, and the second test was also negative. Several days after I developed symptoms, my wife did as well, and I was able to get her on the hydroxychloroquine Z-Pack regimen as well, and she has had, and she was also COVID positive when she got tested, and she has had a similar experience to my own. I'm well aware of the studies around the world, and there are literally tens of thousands of patients on the drug worldwide, which, by the way, has been around. The drug has been around for over 70 years and has been used in the prevention and treatment of malaria, as well as treatment of lupus and rheumatoid arthritis. It's a benign drug that is universally used, and literally thousands of patients have used the drug for the coronavirus with near 100% cure rates. So it's really a no-brainer, and I agree with everything that has been said, that the sooner the drug is used, the better.
Great.
And it should be available to anyone who tests COVID-19 positive.
Thank you, Mr. Knight. I appreciate it. Your 3 minutes Mr. Gilbert, I appreciate that. Dr. Gilbert. Okay, seeing no further public comment. I have no public comment. I did receive correspondence to be submitted for public comment from Bob Layton, Chief Bob Layton from Reno Emergency, who's the Reno Emergency Manager. He did send me a correspondence and asked this be put into the record. Please express that the City of Reno Emergency Manager Bob Layton supports the restriction for hydroxychloroquine being rescinded and allowing the decision to prescribe the medication placed at the physician level. Please read my letter into the record. So I will place that letter in the record with the clerk. At this time, I'm going to bring it back to the board and for discussion. Commissioner Jung, I have you signed in first for a question. Commissioner Jung.
Thank you, Mr. Chairman. I have a question that probably can't need to be answered today, and that is, from all the research I've done and speaking to our district attorney's office, where are we, or where can I get some data on this in terms of a reported supply chain problem? And how can I reassure those patients in Washoe County who are currently being treated with this medicine for lupus and other diseases? I think that you about. Hello?
Hold on, Commissioner Jung. We got you fixed now. It's sorry, we had somebody step over top of you. Go ahead.
Could you hear what I said?
Yeah, we got you up to the point where somebody but go ahead. We're good.
So how can I reassure patients in Washoe County that are already on a regimen for this drug for other needs, like I mentioned, lupus, et cetera, are not at risk of losing their supply? Because that must be assured first to me. And I also need to know what, if any, response you received from the governor or his appointee, or none at all from your letter. And then finally, and this is a broad one, it needs to be at the next meeting, whatever that meeting is. And when it comes to amicus briefs, I don't think we have a policy on that. and recommendations for amicus briefs. So I would like staff to come forward with that and give at least 3 recommendations on how we do this as a general government policy, because I don't believe I've ever done this before for a pharmacy board. Can I make the nexus that, or a governor's order or whatever it may be, but can I make the nexus that yes, we do control our own county, certainly through the health districts, but I still need to know best policies, and most importantly, a provision or something in the language that says people who are already on this regimen will not have people cut before them and deplete our resources, because I understand this is also a drug that is highly sought after and has a supply chain issue. That's all I've got. Thank you, Mr.
Great, Commissioner Jung, thank you. Commissioner Hartung.
Thank you, Mr. Chairman, and I respect everybody's comments. I am supportive of this, and my commentary is not centered on hydroxychloroquine, chloroquine, or any other pharmaceutical's efficacy to treat any disease. Rather, for me, this is about letting physicians determine how, when, and whether to prescribe any drug they best think fits a treatment regimen for a particular patient with a given diagnosis in order to obtain a positive outcome for that particular patient. It's the physician's duty to judge risk versus reward when prescribing any treatment or pharmaceutical to their patients. And so I'm supportive of the brief with respect to a physician's rights and duties, regardless of the drug we're talking about. Thank you, Mr. Chairman.
All right. Thank you, Commissioner Hartung. Commissioner Herman.
Mr. Chair, I just want to thank the professional doctors that came on board here and all their information. I agree totally with them, and I applaud you for coming to the forefront and against this cruel assault on our lives. I think that it's good timing. Maybe we're even late, but let's get with it. I agree with this. Thank you.
All right, thank you, Commissioner Herman. Seeing no further public, I have no other commissioners sign in at this time. I think we've heard enough discussion on this in regards to our. Commissioner Jung?
Sorry,
Okay.
I texted you.
Okay, go ahead.
Sorry.
No, go ahead.
I have one more thing I want to say on the record, and that
Okay.
is, I support anybody who would like to challenge rules or disagreements through the civil process of suing. That's not anything at all saying about the merits of a lawsuit or whether you should sue. That's part of a civil society. But what I will stand up for is, bottom line, this is between a doctor and their patient, and here's the best deal. If the doctors harm their patients, we know how litigious our community can be, and that will be the doctor that has to hang on that with his expertise or her expertise. And but I'm not saying that they don't have a right to sue. I want to make that very clear. And that really, the ultimate decision lies with the care provider and their patient, and the liability lies there. But still, I need to know about supply chain, and I got no information on that. Thank you.
All right. And so, thank you, Commissioner Jung. In response to Commissioner Jung, I will work on that, getting you your information. But one of my things is in regards to the amicus brief, and to answer your Commissioner Jung's discussion, I did send the letters, both my letter in a very professional manner to both the Board of Pharmacy and the governor's office, to the governor himself. I did have a brief conversation with the governor, just asking, as I said, my position is for the public, the safety of the public, and trying to fight this pandemic in the sense of getting people the proper treatment when they are asked to stay home and fight this, and allowing the doctor to have that ability to do and treat their patients. That is the only driving factor. I felt that that was a professional standpoint. This has never been a discussion that I was trying to cavalier. I was just merely asking in regards to our mantra, which is maintaining a safe, secure, and healthy community, and especially amidst this pandemic. That was my driving force in behind this. I agree with Commissioner Jung that the discussion about where's the data on the supply chain, and I'd like to see that data either from the Board of Pharmacy or from many of the individuals. I'd like to see that info. But the amicus brief is that we just support the intention and the need to move forward with this. Not that we have standing to file an injunction on behalf of the pharmacy or anybody, but we're just supportive. And that is my feeling based upon the discussions that I've had with our district attorney. So, Madam Vice Chair, I have you signed in.
Thank you, Mr. Chair. It's probably unnecessary for me to add this, but I will just add that I think that medical care is between the doctor and the patient, not between the pharmacy board. Or this isn't a political issue, or it certainly shouldn't be. I totally agree with Commissioner Jung that I think we need to know the efficacy and all the other issues that go along with it if we were to jump into some major lawsuit, but I don't see an amicus brief as that, so I can't see any reason why we shouldn't support this, but I totally agree with both you, Mr. Chair, and with Commissioner Jung that we absolutely must make sure that health care is between the doctor and the patient, not between us or any of us telling patients or telling doctors what they should be doing. And maybe I also should put on record that my husband was a pharmaceutical salesman for 35 years or something like that. So I have extensive experience working with the pharmaceutical industry, and also the Abbott reps are all close family friends, so just for the record.
Great, thank you. All right, seeing no further discussion from any of the commissioners, I'm looking for a motion at this time. Commissioner Herman, I have a motion from Commissioner Herman.
A second?
I have a second from Commissioner Berkligler. I'll call for the vote. All those in favor signify by saying aye.
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 No.
Okay, I have a no from Commissioner Jung, aye from the Commissioner Herman, Commissioner Berkligler, and Commissioner myself. And then I have, one second. We've lost Commissioner Hartung. He's on the phone. We do have to call him back. Give us one brief second he would like to institute his vote. So I've got 3 yays and 1 nay at this point.
Mr. Chairman,
Yes, Commissioner Jung.
just to reaffirm, I didn't say anything about
Mr. Chairman.
efficacy or data because I don't know, and I think the jury is out. It's also not my call.
Mr. Chairman.
But as I said, I would be supportive of this if
Yeah.
the supply chain was reassured to me. Thank you.
Okay, thank you, Commissioner Jung. Commissioner Hartung, we have called for the vote. We have a motion to support the amicus brief. You're back on the phone with us now. We have your vote, sir.
I'm an aye, sir.
I have an aye from Commissioner Hartung. The motion carries with 4 in the affirmative and 1 in opposition, Commissioner Jung being in the opposition. All right, with that, thank you very much, everybody. I appreciate the participation in that this morning and allowing me the ability to move forward with that. All right, we are going to move back to our proclamations. This is item 6. Mr. Manager, 6A.
All right, 6A is a proclamation proclaim April 2020 as National Donate Life Month.
All right, and Commissioner Hartung, I believe, is on the phone and is going to present and read this proclamation. We also have Dr. Knight from our medical examiner's office joining us via Zoom to receive the proclamation. This is very new and very interesting for me, being that we don't have the recipient, nor do we have the commissioner here, but we are doing our best to do this via digitally. So, Commissioner Hartung, if you'll read that proclamation, please.
Thank you, Mr. Chairman. As everyone knows, this is very near and dear to my family's heart. And it's just something that you cannot even begin to understand until you've walked this mile, either having a family member that is a recipient or being a family that has donated an organ or organs. And that it's the strongest gift that anyone could ever give. It's just amazing. So, whereas Washoe County strongly supports organ, eye, and tissue donation because of its life-saving healing opportunities. And whereas nearly 113,000 Americans are currently awaiting a life-saving organ transplant, including 643 Nevadans. And whereas one heroic donor has the power to save up to 8 lives through organ donation, restore sight to 2 people through a cornea donation, and enhance the lives of 75 others through tissue donation. And whereas 95% of people say they support organ donation, but only 61% of Nevadans have demonstrated it by registering as donors. And whereas people of all ages are considered potential donor heroes. And whereas Washoe County, the Washoe County Regional Medical Examiner's Office, and the Nevada Donor Network stand together to raise public awareness about donation and the importance of becoming a registered donor in order to save lives and heal more lives. And now, therefore, the Washoe County Board of Commissioners does hereby proclaim April 2020 as National Donate Life Month and encourages all Washoe County citizens to consider the simple but generous act of registering as an organ, eye, and tissue donor at the DMV or online at registerme.org. It's dated this 21st day of April 2020, signed by your hand, Mr. Chairman, Bob Lucy. And I really appreciate it. Thank you so much.
Thank you, Commissioner Hartung. And Dr. Knight, we have via Zoom. Dr. Knight, do you have some comments you'd like to make?
Yes, thank you, Chair Lucy, and thank you, Commissioner Hartung, for reading that. I want to thank the board for your ongoing and substantial support of organ and tissue donation. This is a cause near and dear to our hearts in Washoe County and at the Regional Medical Examiner's Office. And as you all know, our office started a partnership with Nevada Donor Network in 2017 and bridged a gap in our community, allowing individuals who die at home or outside of a hospital the chance to donate life-saving and life-restoring corneas and tissues. And we have referred literally thousands of potential donors now to Nevada Donor Network, and there have been hundreds of successful cornea and tissue donations as a result. And so we're very proud of that, and we are just thrilled that, again, the Commission has chosen to make this National Donate Life Month. So thank you very much for your support and recognition of this important issue.
Thank you, Dr. Knight. We appreciate it. All right. We are on to item 6B. Mr. Manager.
6B is to proclaim April 2020 as the National Child Abuse and Neglect Prevention Month.
Thank you, Mr. Manager. And Commissioner Jung is going to be reading this one into us for the record, and she is joined today via Zoom with Ryan Gustafson for our Human Services Agency. So with that, Commissioner Jung, the floor is yours.
Thank you, Mr. Chairman. Well, as you know, because we are quickly learning, I hope, in this crisis that public schools do a whole lot different things than just K through 12, much like when we were in school. They not only provide nutrition, a great deal of daycare, let's be honest, and eyes and ears to prevent child abuse. And now we know that children are not having those mandatory reporters, so it's more important than ever that we bring the focus on preventing and saving children who are in those very quiet now and no eyes on them situations. So I'm glad to do this. Whereas the Human Services Agency's Children's Services Division remains devoted to the well-being of our children by ensuring they live in a safe, secure, and healthy community, and whereas in fiscal year 2019, 6,568 reports were made to the Human Services Agency. The agency's top priority is the protection of children. The agency works diligently to preserve family strength by providing biological parents with assistance needed to promote nurturing homes, keeping their children safe, and preserving the family unit. Whereas in fiscal year 2019, the Human Services Agency reunited 286 children with their families. Multifaceted, intensive, family-centered support and services were implemented to help build on family engagement and connections, ensuring children return home to a safe and stable environment. And whereas April is nationally recognized as Child Abuse and Neglect Prevention Month. Every April, the Children's Services Division joins in the national effort to raise awareness during the first week of April of placing hundreds of blue pinwheels outside several Washoe County buildings. The pinwheels represent the joyful, carefree childhood every child deserves. And whereas the public is encouraged to join the national effort by wearing blue clothing or a ribbon during the month of April. Now, therefore, the Washoe County Board of Commissioners do hereby proclaim that April 2020 is National Child Abuse and Neglect Prevention Month to raise awareness about child abuse and assist families in times of need, signed by our Fair Chair, Mr. Robert Lucy. And I would like to add to that, Mr. Chairman, you and your wife single-handedly, I would say, and people might not know this, but Megan Lucy is in charge of our family reunification vis-a-vis when it doesn't work anymore and we need to adopt children to a different custodial care. I know you both have partnered in all of the awareness for that, and I know because you have two very small children, you're well aware of how fragile they can be. So I want to thank both Lucys for all the work that they've done to ensure children get a shot at being children, first and foremost. And then, of course, our Human Services Agency, Mr. Gustafson, under the direction of Powell, have taken us with the chairman's leadership to a whole other level when it comes to human services. So this one you should have read, Mr. Chairman, but I did it for you. Thank you.
I appreciate it. You know, that was orchestrated in the sense that I like to milk comments out of you. But I'm going to go to Ryan Gustafson. Mr. Gustafson, please, do you have? We'd like to hear from you.
Yeah. Well, first, thank you, Chair and Commissioners, for your support and your recognition. You know, as stated in the proclamation, we at Washoe County Human Services Agency, we have planted hundreds of blue pinwheels throughout the community. And, you know, that's an important activity for us because it really does represent, you know, that children deserve and they should have a joyful childhood and a carefree childhood, free of abuse and neglect. And for the Human Services Agency, protecting children is extremely important to us. And what we would ask is for the public and the community to be vigilant and watching for signs and for abuse and neglect. And if you suspect that that's occurring, you know, please contact the agency at 833-900-SAFE to make those reports. We just like to, again, thank the commissioners for recognizing this important issue. And to the community, please follow Washoe County on Twitter and Facebook. Help us raise awareness by using the hashtag #PinwheelsForPrevention. Thank you.
Thank you, Mr. Gustafson and Commissioner Jung. This is very important to me. This is one of those very important issues, and I think more now than ever in regards to the stay-at-home directive. And as we continue to see families stay at home and potentially domestic violence rise, we got to make sure we protect those children that have sometimes little to no voice and provide them the support that they need. And I can't thank this commission enough for their continued support of the Human Services Agency and their efforts to place children with forever families, get them out of situations where we feel that they are not going to thrive. And one life that we save will not just be that one life, but it'll be multiple lives down the road in regards to their ability to show the advocacy that the Human Services does during this. So to highlight this during National Child Abuse and Neglect Prevention Month is fantastic. Thank you. All right, with that, we will move on to item 6C. And I am going to have Commissioner Herman read that in. You could just right there. No, read right here. That way we get you all on the record.
Thank you, Mr. Chair.
Oh, and Commissioner Herman, right before you jump on there, I do have Deputy Tim O'Connor here joined with you via Zoom on the phone after your, so with that, Commissioner Herman, the floor is yours. I apologize.
Washoe County, Nevada's proclamation. Whereas, behind every emergency response that takes place in Washoe County, there's a team of dedicated professional communications specialists who are now only recently known as the first responder, and your most vital link between our emergency services and citizens. And whereas, Washoe County communications specialists are the lifeblood of information for more than 500 public safety personnel 24 hours a day, 7 days a week. providing a critical safety service to the Washoe County Sheriff's Office, North Lake Tahoe Fire Protection District, Truckee Meadows Fire Protection District, Pyramid Lake Fire, Pyramid Lake Police Department, Reno Sparks Indian Colony Police Department, Washoe County Alternative Sentencing, United States Department of Veteran Affairs Police, and After Hours Washoe County School District Police. And whereas the 29 communications specialists and 5 communications supervisors who serve at the Washoe County Sheriff's Office Communications Center have exhibited compassion, understanding, and professionalism during more than 150,000 calls for service each year, covering an area of approximately 6,700 square miles with over 112,000 residents. And whereas every Washoe County communications specialist and supervisor is certified by the International Academy of Emergency Dispatch in 3 disciplines of emergency medical dispatch, emergency police dispatch, and emergency fire dispatch, so that they may provide a substantial contribution to the apprehension of criminals, suppression of fires, and the treatment of medical patients throughout the Washoe County. And now, therefore, the Washoe County Board of Commissioners does hereby proclaim April 12, 2020 through April 18th, 2020 to be observed as National Public Safety Telecommunications Week in honor of our county's less visible but vitally important first responders, the dedicated and professional communications specialists and communications supervisors who are always ready to serve the interest of public safety, no matter how difficult or stressful the circumstances. Dated this 21st day of April 2020, and signed by Bob Lucy, Chair of Washoe County Commission. And God bless every one of those people. They deserve this.
Thank you, Commissioner Herman. I appreciate that. And we have Washoe County Sheriff's Office Deputy Tim O'Connor joining us via Zoom. Mr. Deputy O'Connor, Chief Deputy, can you hear us?
Yes, sir. Good morning.
Good morning, Mr. Chief Deputy. Go ahead.
Well, Mr. Chairman and Commissioners, thank you very much for the recognition that you gave to our dispatchers, the men and women, the supervisors, and the dispatchers themselves. They really are the first responders. They often deal with our citizens at the worst time in their personal lives, dealing with medical emergencies, fires, or law enforcement emergencies. They're able to bring some sense of calm and to the individual calling, and while doing that at the same time, they're dispatching the appropriate resources to the citizen so that in a very timely manner, they receive the medical, fire, or law enforcement response that's needed. It's due to the hard work of these men and women that we're able to provide this service, and we are very grateful that you recognize them. From us at the Sheriff's Office, they are our link to the citizen, and we very much appreciate all of the hard work that they do every single day and night to keep us tied in with our community and providing the proper response that they need. So my thanks to them, and my thanks to you for recognizing them. Much appreciated.
Thank you, Mr. Chief Deputy. We appreciate you joining us this morning, and I would absolutely share that same. We want to thank from the commission on we always talk about the thin blue line and the thin red line about public safety, but very rarely do you hear about the thin yellow line. Those men and women behind the scenes that are often behind the computer or on the phone during tragic situations, and it's those dispatchers that make sure that our community stays safe. They are truly on the front line, and so we want to thank them during this week. So thank you. All right, we are on to item 6D. Mr. Manager.
Item 6D is to proclaim April 19th through the 25th, 2020 as National Library Week.
Great. Thank you, Mr. Manager. And for that, the Madam Vice Chair, Burke Bigler, will be reading this proclamation for us, and she's joined today on Zoom with the Library Director, Jeff Scott, and then Emily Reed, who is the head of our Law Library. So with that, Madam Vice Chair.
Thank you, Mr. Chair. You know, the libraries are a wonderful part of Washoe County. And of course, they are closed right now. We understand that because of the virus, but this is an area where they provide a greater service than just being able to go there and read a book, although that's a pretty nice thing to be able to do. But they also provide computers and all kinds of other things. And so it's a really great opportunity for us to have our libraries back open again as soon as we can get them back open again. So whereas today's libraries are less about what they have on the shelves and more about what they do with and for their communities. And whereas libraries have long served as trusted and treasured institutions where people of all ages, interests, and backgrounds can come together and learn alongside one another. And libraries and librarians work to create an equitable society by providing free access to accurate information to all people. And whereas libraries of all types are at the heart of their cities, towns, schools, and campuses, and libraries offer members of the community a welcoming space and opportunities to explore new passions through technology, programs, and services. And whereas libraries and librarians help patrons find tools to help improve the quality of their life, and libraries which promote the free exchange of information and ideas for all are the cornerstones of democracy. And whereas libraries strive to develop and maintain programs and collections that are as diverse as the populations they serve. And whereas libraries are a resource for all members of the community, regardless of race, ethnicity, creed, ability, sexual orientation, gender identity, or socioeconomic status, and offer services and educational programming that transform lives and strengthen communities. And whereas libraries, librarians, library workers, and supporters across America are celebrating National Library Week, now therefore, the Washoe County Board of Commissioners does hereby proclaim April 19th through the 25th, 2020 as National Library Week, and encourage all residents to visit the library when they're open again, a place where we can all belong and discover who we are. Because of you, libraries transform. Dated this 21st day of April 2020 and signed by our chair, Bob Lucy.
Thank you, Madam Vice Chair. And it sounds like we have Director Jeff Scott, and so we'll go to Director Jeff Scott first.
Thank you, Commissioners. I appreciate your support of the library. Washoe County supports Washoe County Library with 80% of its budget. And also, I want to thank the Washoe County Commissioners for their support with their special district funds. All of you have provided financial support for the library in the last 5 years. Most recently, Commissioner Lucy, Chair Lucy, has provided $5,000 for the Friends of Washoe County Library. And we've been able to use a portion of those funds for our PPE project. We are using our 3D printers to print face masks for our hospital heroes locally in partnership with UNR Libraries and Grafton Company. This year, we're encouraging people to attend the library at your home. Our librarians are working with virtual story times, providing digital collections. You can download thousands of ebooks, downloadable audiobooks, as well as a variety of other materials such as digital magazines. Lynda.com, you can access workforce development programs, as well as learn a new language. We encourage you to go to our virtual story times on Facebook every morning at 11 and the afternoons at 4 p.m. as well. And we want to support Washoe County and everything we're doing for our citizenry. And while the library's closed, the digital library is always open. So while you're staying home for Nevada, we encourage you to find your library at home. So thank you, Commissioners, for this proclamation and honoring the library today.
Thank you, Mr. Scott. We appreciate you joining us this morning. We have also Miss Emily Reed.
Hi, thank you so much. Thank you for celebrating National Library Week with us and for your support of the Washoe County Law Library. During the COVID-19 emergency, our law library continues to be available to assist members of our community. Today, our team's available to answer your reference questions through live chat, over the phone, and through our Ask a Librarian email, all from the comfort of your home. We have a number of databases available online, and we encourage you to check those out. We are also offering our Lawyer in the Library program through Zoom. You can sign up for that on our website, washocourts.com. We know that many families are facing difficult legal issues and do not know where to start gathering information. Please remember we're here for you and can help you access legal information and resources. Thank you again to our Board of County Commissioners for bringing everyone's attention to National Library Week. We will continue to provide you with services remotely, and we look forward to helping our community in every way we can.
Great. Thank you, Mrs. Reed. We appreciate you joining us today with the Law Library. Okay, with that, we have done all of our proclamations this morning here. We want to thank everybody for joining us and all of our commissioners for participating. At this time, I'm looking for a motion to accept the proclamations.
So moved.
I have a motion and a second. A motion from Madam Vice Chair, second from Commissioner Herman to accept the proclamations 6A through 6D. All those in favor?
Mr. Chair?
I'm sorry. Do we have any public comment?
We don't. I just want
Okay.
to make sure you ask for it.
Yes. Thank you, Anna. I'm looking at my screen, and I know it's very difficult for everybody joining us. Sometimes if I don't iterate that verbally, I am looking at my screen, and I have not seen it. So I do have called for public comment. We have none on the proclamations. We do have a vote. All those in favor signify by saying aye. Aye. Aye.
Aye.
All those opposed? Motion carries unanimously with Commissioner Hartung and Commissioner Jung voting in the affirmative over the phone. We affirm the votes as unanimous. All right. We are on to item 7. This is our donations. And Madam Vice Chair, will you please read us our donations this week or this month?
Yes, Mr. Chair, I will. Item 7A is a recommendation to the Board of County Commissioners to acknowledge a bequest of paintings by Paris Frucioni. It is a $25,000 value with no county match required. And this is to the Second Judicial Court, District Court from the estate of Mr. Martin O'Conlon. 7B is a recommendation to accept a Burning Man donation in the amount of $3,000 for Washoe County Emergency Management to offset some of the costs associated with increasing support needs for Burning Man. On item 7C1 is a recommendation to accept a one-time appreciation gift donation of 20 dinner and 2 one-night stay gift certificates from the Incline Hyatt Regency, estimated value of $5,000 to the Washoe County Sheriff's Office. 7C2 is a recommendation to accept a donation of 540 American flag lapel pins, total estimated value of $11,880 from a private citizen to the Washoe County Sheriff's Office to be distributed amongst commissioned staff members to wear on their uniform and as giveaways to visiting dignitaries. Item 7C3 is a recommendation to accept a donation of a sprung tent structure and 11 combined air handler, air conditioners, heating units, total estimated value of $1,213,827 from a private citizen to be used by the Sheriff's Office to store and protect assets for the Special Operations Division. Item 7D1 is a recommendation to, 1, acknowledge various items donated totaling an estimated market value of $1,050, and 2, accept donations to the Human Services Agency Senior Services Fund to support operations of the Washoe County Senior Centers in the amount of $102.76, retroactive for the period of January 1, 2020 through February 21st, 2020. And 7D2 is a recommendation to acknowledge various items donated totaling an estimated market value of $2,545, and 2, accept donations to the Washoe County Human Services Agency to support child welfare activities in the amount of $606, retroactive for the period January 2020 through February 21, 2020. You know, we are very blessed here in Washoe County that we have citizens who continually make donations and give us gifts like paintings for our court systems and all the other things that go on. Our citizens really are very active and interactive with us, and so we are very blessed, and I want to thank everyone who is on this list on behalf of the county for making these donations to us. Thank you, Mr. Chair. That's in the form of a motion.
Thank you, Madam Vice Chair. So I have a motion from the Vice Chair to accept the donations. Do I have a second?
Second.
I have a second from Commissioner Herman. All those in favor signify by saying aye.
Aye.
All those opposed? Motion carries unanimously with Commissioner Hartung and Commissioner Jung voting in the affirmative via phone. So.
We had no public comment.
And
Mr.
no
Chairman.
public comment. I did not see any public comments on in. And it's real. I'm telling you, I'm still getting used to this digital meeting thing.
Doing fine.
All right, we're on to item 8. This is our consent agenda, and it's just one item today for consent. Does any of the commissioners need any presentation? If not, I'm looking for a motion to accept the consent agenda.
So
moved.
I have a motion from Commissioner Herman, second from Commissioner Hartung to accept the consent agenda. All those in favor signify by saying aye. Aye.
Aye.
All those opposed? Motion carries
You
unanimously.
want to ask for public comment on that as well?
Oh, yes, thank you. Gosh, I did not see, is there any public comment?
No, sir.
Seeing no public comment and nothing signed in on my screen. We are on, that is at the end of our consent agenda. We are on, I promise I'll ask for it probably before the end here.
Mr. Chair, I just want to add something on the record about that real quick if I can.
Sure.
Thank you. I know that I'm familiar with the procedures that you're using for the meeting and some of the practical issues with this, but and I know that you're checking as you're calling these items to see if there is any public comment, and so you are moving through it in that way. And I just want to put it on the record that you asking for it is simply something that's for the record, so that we know and have it in the record that it was sought out, even though I know you are checking as you're going along.
Yeah, thank you, Mr. Edwards. I appreciate that, and it is very difficult, and I need to understand that many of their audio recordings are for individuals for posterity into the future. People need to understand that I did call for it, and so I thank you for stopping me and putting that on the record, because even though I can see it digitally right here in my multiple screens that I'm trying to manipulate, it's sometimes I need to stop and remember that I need to put that verbally on the record. So thank you. All right, we've ended our consent. We're on to item 9. Mr. Manager, would you take us into item 9, please?
Item 9 is a recommendation to adopt an ordinance authorizing the issuance by Washoe County, Nevada, of its general obligation limited tax sewer bond, additionally secured by pledged revenues, serves Series 2020 in the maximum principal amount of $27 million for the purpose of financing sewage projects for the county, providing the form, terms, and conditions thereof, and covenants relating to the payment of said bond, and providing for its adoption as if an emergency exists, and providing other matters relating thereto.
Thank you, Mr. Manager. We are joined today on this, and Madam Clerk, can I get you to change,
Oh, I'm sorry.
move on to the next item? It's okay. Madam Clerk?
And for the record too, this will be bill number 1837, and if adopted, it will be ordinance number 1647.
So Bill 1837 and ordinance 1467?
1647.
1647.
And the manager read the entire item, and that, with the exception of the recommendation 2, is exactly the reading of the ordinance that I had for you today.
Thank you, Madam Clerk. I appreciate you putting that on the record. We are joined for this item with staff. We do over the phone have our Assistant County Manager, Christine Valetich, that is in charge of our finance. We have Kendra Follett, which is our bond counsel here for Washoe County. We also have Marty Johnson, who is our bond financial advisor, all joining us via phone for this, and also Dwayne Johnson, who is our CSD manager at this time, that has been heading up water and sewer. So with that, is there any discussion for this? Ms. Valetich, do you want to chime in on this?
Yes, thank you, Chair Lucy, and good afternoon, Commissioners. Just very briefly, today the board is being requested to adopt an ordinance to issue these general obligation bonds in the principal amount of $27 million to provide the financing for the South Truckee Meadows Water Reclamation Facility, which also includes Half-Acre Hills Reservoir lining. This project began several years ago. The financing piece of it, on December 11th, 2018, the board directed staff to apply for a loan through the state of Nevada, the Clean Water State Revolving Fund, which we had done. We've been before the board a number of times, most recently with a public hearing in March of 2019. The project was delayed a bit for some environmental issues, but is now back on track. And upon the board's, or should the board adopt the ordinance today, the county would enter into a loan contract with the state of Nevada through the revolving fund loan program. So state revolving fund loans are issued in the form of a bond, which means and that's per NRS Chapter 350, which means we go through the bond issuance process, but the state of Nevada is the sole investor. They purchase the bond, and they are able to provide us with a below market interest rate through the state revolving fund loan program, which is really the least expensive financing available to the county. And I guess I will leave it at that and see if there are any questions. Thank you for also introducing our consultants and staff that are available to answer any of your questions.
Thank you. Commissioners, I'm going to turn this to you really quickly. Are there any questions by any of the commission? And this is an issue that we have been dealing with for some time. So at this time, I'm, without any further discussion by the commission, not looking for any further information on this, looking for a motion to accept this
Mr.
item.
Chair?
Madam Vice Chair.
I would make a motion to adopt the ordinance number 1647, authorizing Washoe County to issue general obligation bonds for
Okay.
sewers.
I have a motion from Vice Chair Burke-Bigler, a second from Commissioner Herman. Madam Clerk, do I have any public comment signed in? I see none on my screen signed in. And all right, I have a motion and a second. All those in favor, I'll call for the vote. All those in favor signify by saying aye.
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 Commissioner Hartung or Commissioner Jung?
Aye.
I said aye. Sorry.
Did we lose?
Hello?
Commissioner Hartung?
Can you hear me? Hello? Hello, hello, hello?
You good? All right,
Hello?
I have 3 ayes.
Mr. Chairman, did she unmute it?
I got you now, Commissioner Hartung. Was your vote is an aye?
Hello?
Or? Okay.
I'm an aye.
Aye, and Commissioner Jung, you're an aye as well?
Yes, please.
Okay, so I have all 5 commissioners voting, all in the affirmation to accept the ordinance, and we will move on. All right, we've done item 10. We are on to item 11. This is, item 11 is under my, is in need today. Is that correct, Mr. Manager? So I'm looking for item. We do need a possible closed session today to discuss county staff issues and labor negotiations. I'm looking for a motion to put us into a closed session after we recess from our meeting here.
Mr. Chair, I would move that.
All right, I have a motion from the Madam Vice Chair. Do I have a second?
Second.
I have a second from Commissioner
Hartung.
Second from Commissioner Hartung. All those in favor signify by saying aye.
Aye.
Motion carries unanimously with Commissioner Hartung and Commissioner Jung voting from the phone. We are on to our final public comment for today. This is obviously, do we have any public comment signed in, Madam Clerk?
We do have a voicemail from Barbara Poole, which we will play.
Okay, thank you.
And this is for the County Commission chambers. I think all the developers should go home. We have too much building around here, and I don't know what anybody has against a beautiful tree or a wide open space, but I am sick of it, and I think the developers should all go home. Thank you.
All right, we'll place Ms. Poole's comment on the public record.
That was all I'm aware of. I don't know if we have
Okay.
anybody on Zoom.
We have nobody from Zoom, our Zoom meeting, or on the phone that would like to speak. So we will bring it back to the board and close public comment. We are on to our final commissioners and managers announcements. So, Mr. Manager, do you have anything that you would like to add since we first got started?
Nothing further, Mr.
All right, seeing nothing from that. Commissioner Jung, I had you signed in. Would you like to speak?
Yes, sir. Thank you. I would like to figure out how I could or the board could encourage, while we are not the authority over the libraries, but encourage that they open up their drive-up windows for materials. That's easy to control, easy to sanitize, and many of my senior citizens who live and die for the library, and I put myself in that, I'm not a senior citizen, but I'm very much missing the library as well. I think that that is a place that, with the guidance of the district health officer, et cetera, the library board should consider, or the library director should consider to allow people to use the drive-up option. Thank you.
Thank you, Commissioner Jung. Commissioner Hartung, do you have anything you'd like to add this afternoon?
No, Mr. Chairman, I don't.
All
Thank
right.
you.
And then I have Commissioner Herman signed in. Commissioner Herman.
Thank you, Mr. Chair. We had a citizen come to the building today in hopes of coming in and speaking in public comment. And was very frustrated because this meeting is normally an open meeting and it has to follow open meeting laws. And I think that maybe we should probably make some kind of a declaration about that to explain it to the citizens. That is there, are we in full legal mode when we're doing what we're doing? We just need to be able to explain that to the people that don't understand and sometimes can't really get onto the Zoom or voicemail thing. You know, maybe they don't even have a phone. But anyhow, it just seems like we should clarify that for the public. Thank you.
Thank you, Commissioner Herman. You know, and I would make a comment to Commissioner Herman. It is very difficult. Obviously, this has been a very much of a new horizon and new landscape for us to kind of navigate as we move through public meetings that are absent physical public here in the chambers. And so, but when we have done this based upon the governor's declaration of emergency, Directive 006, Section 2, it does allow public agencies the ability to be flexible with how we do this amidst the COVID response. And I want to assure everybody, the public, is that when we change, or if the directive change, I assure you we will go back to hopefully a standard type of meeting. It might be a little different with social distancing and some different manners to get into the chamber, but we do anticipate public coming to participate with us. That's our intention and our hope to do this soon. And for those individuals, you know, I think you're right, Commissioner Herman, that it is sometimes challenging. Maybe not everybody has the ability to either log on to a Zoom meeting or maybe leave a voice message through our thing. But you also could potentially drop off. The buildings are open to an extent to our lobbies. You could bring a written public comment that we will read in if that's something that they would like to do, and drop that with our security officers, and that would be delivered to the manager's office that we could put on the record. Maybe we find some ways for those individuals, and I hope, like I said, we will get back to that type of meeting here soon. So, Commissioner Herman.
This person from the public was prohibited from entering the lobby and prohibited to use the bathroom And so I just want to make, I think maybe we could get the district attorney's office to write something up that explains our position, so
Okay.
we don't get ourselves in a little trouble.
Absolutely. We'll reach out to David Wattsfield and Mr. Nate Edwards to work on that. All right, seeing no further public comment, or I have nothing to add, I want to thank everybody for joining us today via Zoom and via phone. Commissioner Hartung and Commissioner Jung. Yes, Commissioner Hartung.
So it's
Mr. Edwards.
I have some information for you that I've been provided about item 11, which was the closed session. I'm being told that there's no need for a closed session, that it's only an attorney-client that is necessary.
Okay, so there is no need for the closed session, the motion. So we can adjourn the meeting instead of recess the meeting. Is that correct, Mr. Edwards?
Yes, that's correct.
Okay. All right, seeing that there is no, we are going to adjourn the meeting and no need for a labor closed session. We will be adjourned. I want to thank everybody for joining us today, and we will see you in a week. Thank you.